am the Chief Technology and Strategy Officer for Oracle's emerging market business. What that is, a glorious way of saying is, we work with up-and-coming companies whom we think are the Facebooks and Groupons of tomorrow. And we bring in our expertise and we bring in our experience, if you will, on how these organizations work and an industry perspective, if you will, right? So by vocation, I am an enterprise architect. So I like changing things. I like mixing things up, and healthcare, and well, fortunately or unfortunately, is the Wild West vertical of today, right? So there is more unknowns than knowns. And that's interesting because this is an industry that never had to change much for the last 20, 30 years. And now suddenly you're in a pot mix of having to do a lot of different things on targets that's never been defined so far, right? So what I'm going to kind of talk about, cover is, so in my role as an enterprise architect, and I do talk to a lot of healthcare companies, so I'm going to bring two perspectives. One is my understanding as I talk to different stakeholders across the healthcare business, and think of it as an enterprise architect's viewpoint. And the second thing is Oracle's viewpoint, how we are hoping to enable, or how we are continuing to enable organizations that are coping with the changes in the healthcare business. So there'll be two aspects to what I'm trying to communicate here. And hopefully that sets the foundation for a lot of what Steve is going to talk about on how they are addressing certain specific issues around security. Make sense? But if you guys want to take me somewhere elsewhere, I can definitely go there. It's not a problem. But you know, it's security. That's what we'll talk about a little bit more today. So what we'll talk about is, as I said, what I have personally, it's my viewpoint of where healthcare is today, all right? And from an architect's point of view, and then we'll talk a little bit about what Oracle is doing to position and enable this transformation that's happening in the healthcare business. We'll touch upon certain areas on mobility, some case studies, if you will, if you have the time to go through that. A couple of other things, housekeeping, I call it. I speak fast from India, so I have a tendency to just go fast. If I do, two options, raise your hand. I will slow down. Okay, we are not so large that I can't do that. But otherwise, easier one for me is you can listen fast too. That's okay, right? Either works for me. Right, all of you guys have seen this one, right? I don't have to go through this one. You just had this law which passed, and then suddenly the ecosystem completely changed today, right? Then they threw in ICD-10, ACO, Obamacare, this and that. More number of laws have been passed on impacting healthcare than any other business or any other vertical in such a short period of time, right? What that essentially meant is it raised a lot of questions. And not just talking about doctors, I'm not talking about insurance payers, I'm talking about people who actually started seeing opportunities because these new system or new paradigm of looking at healthcare is presented by none other than our government primarily, right? So I got this cute picture of this thing. Because that's kind of the look I always had, okay, before getting into this one. So all these questions, what does it mean by reimbursement? Meaningful use, that's just not 1, 2, and 3, right? What happens to regulations? How am I going to be looked at? What's the impact of these things on me? Okay, how am I going to address all of this in a completely different and a complex ecosystem, right? This used to be two parties before, the patient, the provider and the payer. Healthcare was pretty much defined by these two large entities. But what happened was they said, we're going to bring this one person, highly unpredictable, called the patient. Never going to be responsible for anything, but you're going to try and provide care for him. And it's not just you who's going to provide care for him, it's going to be his gym. It's going to keep him healthy. Why? Because he's contributing to him being healthier, right? I'm going to bring in the pharmacy and see, are you actually dispensing? Are you telling him the impact of what you're dispensing with, right? Are you a physician, the hospitals, right? It's a completely new ecosystem. And then government, which was a reasonably kind of standalone on the side player, became a huge player. He said, I am going to have you tell me how you are managing this person that's highly unpredictable. And you're going to tell me that he's going to live happily, productive, and he's going to be, his quality of life is being managed by all people who have never spoken. In fact, you never even realized that you existed in some cases. And then you're going to show in a measurable manner, and I'm going to ensure that you're going to do that. By the way, I also don't know what it means. But we are going to all work together and providing this quality of care. What it created was, in a fell stroke, right, they took away this concept called, I am an expert in healthcare business. There is no expert. There's expertise in certain areas. But across healthcare as a vertical, there is no expert. There is no somebody who can say that this is what you will have to do so as to, in a measurable manner, deliver the value proposition that's asked of you. See, that pretty much changes the whole equation, but also creates opportunities for two kinds of people. And we'll talk quite a bit about two kinds of people. One is the actual legitimate providers of service. And there could be anybody here, physician, therapist, DME, all these guys. And then people who are from China and Russia, right? They like to use as an opportunity because where there is chaos, there is opportunities of two kinds, right? So, and Steve is going to talk a little bit about how he has looked at addressing the liabilities that is created in these organizations because of people who want the data you have, and you are not in a position to understand what you have and how to protect it. So that's what we'll go into in detail. So now, as I said, I'm an architect. I like quantifying things. If I am sitting in a company that's a player in the healthcare vertical, I like to look at what are the risks I have today, right? So it's an extremely complex ecosystem. How do I manage all of these individual entities in this complex ecosystem? That's the first thing. Okay? I can get fined out of business, especially if you're a smaller organization. Right? I used to work for a company called Hanger. It's an orthotics and prosthetics business. They're the largest provider, close to $1 billion in revenue. Great company. But the biggest fear that my CFO always had was, if I fail the HHSC audit the second time, the third time is a $20 million plus fine, and that could completely kill my market share, my stock price, and pretty much put me out of business pretty fast. I don't know how many of you actually have heard that part. You've been in the healthcare business? Fines? Hey, you guys are lucky. That's what we always talk about. In an executive meeting, it's about how do we not get fined? Okay? Second thing is EHRs. How many of you know what an EHR is? Right. It's basically that stuff that doctors enter your diagnosis and everything about you and store it and say, okay, if it's Venkat, this is this problem he had. Here's his episode. He came in for a cold or he came in for something serious, and I maintain information about you. But they just don't maintain information about just your diagnosis. They also have information about you yourself. How many of you heard of something called CHS, Community Health Services, recently? They were in the news about a month ago. They got nailed. They lost about 4.5 million records of patients. We'll talk a little bit about that. Okay, and you also know that the Forbes came out with an article within the last month that said that could potentially cost that system about $100 million in fines, remediation requirements, and so on and so forth. Basically, it came out of 4.5 million records that got stolen from them. That's about $100 million worth of financial impact to this company, right? They also had an EHR, except that the first generation EHRs, the Epics and the Cerners, who are all providing the systems for hospitals, did not have to change in the 3 decades they have been in business. So they're going through this change significantly, which basically meant that they are still not in a place to help you get ahead of the current problems, right? And if there's somebody who represents any of these companies, with all due respect, that's the challenge you're going through. I have been through an EMR implementation myself. It's not fun, right? And now they have to be the front and center, and that's what meaningful use actually talks about, that you are able to searchable, you're analyzable, and then you're able to report, the 3 aspects to it. And then non-traditional data. So there's another aspect of health science which is called population management. Okay, there's some piece to it. It says it's about you, what kind of place do you live, what's your ethnicity, what kind of diet do you have if you're in this region. It's basically your environment definition almost at some level. So you take that, and then there is your health issue, health data. What they're asking is you have to marry these things. So traditional way of managing a person's information has completely changed. This person's social life, his community environment has become more and more relevant, and that's now key part of what's going on today in terms of providing the quality of care. There's industrialization of business. How many of you know that the healthcare business is going through massive M&A set of activities, massive acquisitions? Payers are buying providers, the other way around. The guys are providing the private practice. It's the best time to be in private practice because you'll get bought out really well. If you're a doctor having your own clinic, man, it's a great time to be in business because they are looking to get your patient list and your services, your community credibility into the hospital. So there's massive consolidation happening, which basically means what? Quick books on one side, and massive business style, your ERP, financial systems on one side, like the Oracles of the world, right? You got to have to bring them all together. What that translates to in common layman terms is more complexity. Yay, joy, right? And then lost revenue potential. You don't know how much revenue you have actually lost. Because you don't know what you have as a potential in terms of what can you get more. Other than when your standard way of billing for 20 years is suddenly changing, they're asking more things, you don't know what you're losing. So you have to be able to quantify what the revenue potential is in an ever-changing business. And, of course, outcome, meaningful use is being defined. By the last count, there are about 20 different organizations, umbrellas, trying to define healthcare standards. 20. The fundamental definition of standard is you all agree to do something very similarly. There are 20 different sets of people trying to do 20 different things to say, I am going to do the right way. And profitability. So these are the business risk aspects that you can name down. That's what a healthcare business is going through today. What does it mean? You have to answer these questions. How can I augment my EHR? How can I make it really relevant for today, right? How do I manage population applications in my EHR? How to make them work together? How do I share data to make it more meaningful so that I can make a very good case with who are the powers that be, right? Who are the powers that be? Leverage big data. How many have heard the term big data? Big data. Hey, NPR recognizes the word big data. I was driving to the airport yesterday, and NPR had a show of somebody talking about big data. So you have to leverage analytics. Everybody wants to be big data, just that nobody knows what big data is. That's okay, but we got to do that, right? You have to be able to do personalized clinical decision support. If you were there in the morning sessions, the significant portion of healthcare today is about decision enablement. So you need to be able to personalize it to the person whom you're treating, considering all the factors. In fact, I have a video that might work out, but maybe not. Revenue cycle management. Simple words, bill. Bill it correctly for the first time. Get the money in time, right? And you should be able to demonstrate compliance. And the key word is not being compliant, but actually be able to demonstrate compliance. And Steve is going to touch a lot about how that's not almost an oxymoron today. But you have to talk about demonstrating, and you have to show that you have done everything technologically and process-wise possible to secure the information, right? So we have risks. You have the questions that are hanging in everybody's mind. And you could call it anything. It's an opportunity to innovate, or that's where you will fail and not be in business. My last EMR was a multi-year implementation. EMRs don't get done in 3 months. What do I do? How do I use additional niche technologies that can get me to the next step faster? It's about going into the market and looking at it really hard. And we'll talk a little bit more about that, right? Spaghetti, that's what comes to my mind when I think about integration. I told you that companies are buying each other out, they're asking systems to talk to each other. If I drew a picture, it'll literally look like spaghetti and meatballs. Okay? I actually had a spaghetti meatball picture that I forgot to put on board, but that's exactly how it looks like. Now, how many of you can go and find that one strand of spaghetti all the way through that awesome dish? Not going to happen. But is there a risk? Yes. Is it an opportunity? Absolutely. How are you going to address that one? Right? Security. That's the theme of today. And funnily enough, when there is chaos, and I'll take this one, go back to anything historically, right? War, health, education, 5 years ago. When there's chaos, you are constantly in what we call a highly reactive mode. We agree? You're reacting to the environment. What gets left? The thing that you don't think about daily is security. How many of you left a cell phone on the reception? I left mine last night. It's 2 in the morning. I was doing the thing. I was half sleepy. I walked out. I expect the cell phone to be on me all the time, that I forgot about it. Just not on top of my head. How many of you go drive in the morning, get out of the house in a hurry and think, did I turn off that stove? Why? Is it secure? You could burn down your house. You realize that, right? That's the fear part. But when you ran out of the house, you never thought about it. It is the last thing you think about. But it is that one thing that will sink you completely, which is why our friends in Russia or in China find this a great opportunity. They think it's an opportunity. Now, it's an opportunity for you to be able to get ahead of them, right? Cost, ROI. You want to be upfront and defining to your stakeholders, people who pay your pay checks, right? To say that here is how I'm going to demonstrate value for you. Innovation. You know that, and I don't know, it could be you could hate war, you could hate all of those things. But when there's time of chaos, it's the best time for you to innovate. You can define needs and you can get this done. Thankfully, we are not in a catastrophic human condition today, but the bottom line is there is chaos in the industry, so it's an opportunity for you to find new ways to deliver better value faster than somebody else, and that's innovation. And then ultimately, standards are a moving target. Are you going to follow and try somebody telling you what you should do, or could you get ahead and say, I know these things, I can set some standards, and I'm going to work through those? It's a busy slide. But fundamentally, this is the definition of healthcare's problem today. All of these things. I'm not here to propose an answer. I'm here to propose a way, and Steve is going to address an answer for a particular set of problems. But understanding the problem is the first step to solving the problem. Right? You heard all of these things. You need to know where you're standing before you can drive somewhere. You need to know what the target is. That's what I'm trying to help you, is to kind of break down your challenge today. I'm a chemical engineer by training. I like chemistry, right? So some of the challenges, standards are not clear. I'm distilling the whole previous page into something even further because, I'm not the smartest person in the town, so I had to kind of break it down further, right? The healthcare business traditionally is a slow changer. They have never had the need to go get ahead and do something fast. If this were Oracle and this is a technology problem, we would have people working on it like crazy from yesterday and have a solution for you tomorrow, or even today. We'll announce the solution today, actually have the solution tomorrow for you. But that's not how healthcare operates, right? It's about information management. And this piece, if there's something you want to take home today, take that home. It is about managing information. Information is money. They are not stealing your bank account. They're not stealing the dollars from your bank account. They're stealing information about you. If you're going to take something today, this is what you need to do today. And of course, technology thought process in the healthcare business is not really suited for what's happening today. This is the fundamental reality that you face today. How could you go about changing it? Force it back to innovation. Get ahead. Start thinking what capabilities, and I'll introduce this word if you've not heard of this one. It's a common architecture term. What capabilities do you need to have as a company? What's the capability? Military talk in terms of capability. I can land an amphibious force on a division level within certain days. That's a capability, an analogy in the military parlance, right? But in this parlance is how I will ensure that I will get my billing claims into the payer system error-free 99% of the time. That's something that you're already working towards today, a lot of you guys. Another thing is I am going to ensure that my analytics capability is top-notch so that I can report within so many hours or so many days, no matter what. So think capabilities that you need to have. What it does is, as other things change, you can work within the capabilities. It's like building your framework and then start working within that to address changes. That's one thing. Show leadership. I call it enterprise architecture leadership, but work on how are you going to solve the problem one step at a time. A solution that Steve proposes. Go ahead and say, how can you make a business case fast enough for it? If you are a stakeholder who are in the healthcare business, you should look at creating business, because your bosses are as confused, if not more, than you. And they see more risk than you do. Help them mitigate the risk by creating business cases. Okay? Now focus on how to secure information. Add big data, learn more, and incorporate that as a capability in your company. The funny thing is the people who are going to drive this change are not IT guys, just so you know. It's going to be the doctors, the operational people responsible in a hospital. Those are the people that you need to work with. And finally, get aggressive of finding technology partnerships. You are in the business of healthcare. You are not in the business of software. Very harsh reality, for especially IT guys in healthcare companies. But guess what? You don't make money on building IT systems. You make money by providing care, not by providing computer systems. Find a way to build partnerships. That's what IQware and Oracle do every day. We build partnerships. We make money by making software, just so you all know. That's why we put in about $5.5 billion as a company last year in just doing research and innovation, R&D, as a company Oracle did. Why? That's our bread and butter. The same thing if you did, it's what's called a sunken cost. It's not going to return value for you. Keep that in mind. Do your business, not something else. Okay? So now I'll quickly jump. Actually, I had a video, but I can't present it. But if you've seen this GE healthcare video, it's a beautiful system, EHR system. There's a guy sitting in the office, and the doctor says, hey, I can't even pronounce the medical term. Okay, I'm an engineer. Okay? So the guy comes and says, hey, I think you could have this. I'm not sure if you're diagnosed for it. And then the audience, the stadium, he says, hey, I'm a doctor. Yeah, he was diagnosed in 2011. He's negative for that. Oh, and then I said, yeah, in 2007, we saw this polyp thing, and he was okay. And they go back, and about 10 different people stand up, and this guy is slowly feeling a little bit, he's sitting in a doctor's office in that sheet thingy. He's like, can I get my pants back? And everybody's clapping, beautiful, awesome, man. Healthcare is awesome. You know what's the scary picture there? How many people have your information? How many people actually know about you? A stadium full of people, and you didn't even know that they knew you. Or actually, they had information about you that I could steal, which is what happened for the incident I told you about. Community health systems. So, why are we in the business? Well, if you understand Oracle's pedigree, right, this is now the Oracle story, right? I gave you my viewpoint. I'm going to quickly, in about 10 minutes, not more than that, 15 minutes maybe. I'll try to keep my promise, right? Oracle story, right? Oracle, incidentally, was security is our actual, you think it's a database company, but actually it was a security project called Oracle for the CIA. That then we acquired the IP for. Larry Ellison was the project manager, developer, and he acquired the IP for it, and actually built the company, what we call Oracle today, on the first system that we worked on, right? So we basically, as a company, we deliver both security and secure solutions, right? And that's why we work with a company like IQware in enabling them to deliver the products as a consumable product for you guys. But if you look at our scenario as a security, right, there are different, we always look at security from inside out. The biggest threat for, and I'll take it through some statistics, right? The biggest risk is your internal resource. You secure your organization internally, It's not the external threat. If you secure it within the company, inside out, you are more secure than not. That's our fundamental philosophy, right? Especially because you're constantly outsourcing data all the time. So more you're able to secure your fundamental systems, your fundamental environment, more people can't get into your environment. So that's our fundamental thought, our basic thought process, right? So, nice graphic. So we look at it in depth, okay? And what is strategic? You don't secure everything. You secure what's based on what's more valuable and what's less valuable. And that's how you're actually fined on too. If you lose a patient's social security number, you get fined a lot more than if you probably lost his, I don't know, his age. That's how it is. So secure what should be secured first, right? So now if you look at healthcare, and this is something that is not Verizon Business Services, right? They published, right? 48% of the records that were breached were against servers in data centers. 48% of the breaches. 5% were due to people with privileged access. Okay? 72% was weak or default credentials. How many of you have password 1, 2, 3 for an iPhone? Change it. 2, 3, 4, 5 doesn't work either, just so you know. If you went into settings, password actually allows you to type in some name and stuff like that. It doesn't have to be just 4 digits, just so you know. But that's an example of a weak credential. And don't do the password in front of somebody. That too. Bad idea. Right? But that's 70, and 12% are stolen credentials. Our biggest fear was somebody with a laptop in their computer getting stolen and had about 20 patient records. That was a nightmare scenario for a company like Hanger. But that's about 12% of how credentials get lost. And we all know the story about how the CIA employee was sitting out there in a cafe in Washington, D.C., and he lost his briefcase, the laptop, and stuff like that. That's that statistic, right? The way Oracle looks at it is, okay, these things can happen, right? Where are the areas we need to secure as we look at healthcare, right? The first and foremost, this is what's happening, right? I mean, people want to diagnose themselves. Virtual healthcare. I mean, half the advertisements by all these large providers come, what do they talk about? A camera, a doctor sitting that side, another doctor sitting in some other country, they're all talking together. That's virtual, right? That's the first one. Second thing is online healthcare. How many of you know MD.com? MD.com, right? How many of you knew that thing existed 5 years ago? Not as many number of people. It's been there for a long time. But more and more people are trying to self-diagnose and get to know more about themselves by going online, but they don't even go to urgent care. If you look at it, we almost regress back to the 40s and 50s where you try to treat yourself really fast, but for different reasons. But now they have these nice websites, many of them, to actually look into and try to diagnose themselves. That's another thing you have, because what does it mean? It means that there is a virtual layer between you, the information owner, and the information consumer. That's a security issue. That's the lens we look at. And again, this is the beautiful thing. Today, you cannot sell a product in a hospital if it does not have an iPad component to it. Every doctor wants to be able to take that thing in the hand, punch it in. That's cool. But you know what? That's a security area. That's the lens we look at it. When we look at the cool things, we also look at how insecure that stuff is, how easy it is for us to penetrate that area, right? So these are the areas that we see are places where we can see the biggest transformations that can occur in healthcare. And these are the areas where you can secure it or need to secure it the most. I'll tell you from a sales perspective, guys who sell the EHRs don't talk about how you need to secure your iPad. It's a responsibility of the consumer, the hospital, to ensure that they do it, right? The other perspective is, fundamentally, it's a data problem. Why? Because it's now you are not able to share information effectively today, so you find workarounds, right? You try to find workarounds, and that opens up huge amount of risk. Now, The opportunity side of it is if you're able to secure this ability to connect it effectively, means that your data sharing problem in a secure manner now means that you can do your business of managing this ecosystem around a patient that much more effectively. These are things to take home and think about, right? And again, another aspect to it is misdiagnosis. But the last fact was about 150,000 patients every year are misdiagnosed because you band-aid information exchange. So you can actually enable information exchange in a secure manner to deliver on not just the ACOs and meaningful use, but actually the quality of care that a patient is actually deserves, right? Then another thing we look at is digital healthcare, right? 50% of adverse drug reactions have been, that's been the amount which is reduced because of digital literacy enablement. How many of you have actually got this prescription from the CVS or someplace and actually read through that thing? It usually, I just tear the top piece of it because I have a HSA. Keep that one. This goes out. But if you are able to enable the same thing digitally, statistics show that 50% adverse drug reactions have actually been mitigated. Somebody taking a drug in the wrong manner, right? And apparently 64% of surgical complications have been reduced too, right? So that is what digital health has enabled today, right? So going into security requirements, right? So now Oracle says, okay, you have all of that. I made a business case at some level to say these are the reality of what's healthcare, here's what you got to do and everything. And Oracle comes and says, we have a slew of products that allow you to secure information through all of these things. I'm not going to go heavily into this one. It's already afternoon. You guys came from lunch and probably have some tea. That's it, right? But it's about malicious insiders. Nobody says that somebody inside the company cannot steal information and sell it, right? You have to provide the right amount of privacy, right? Support from hackers, orphaned accounts. Organizations have people leaving, but their credentials are still in place. That's an easy way to actually steal stuff, right? Application security. Bring your own device. I mean, these things, if you're not a technologist, you might not, well, doesn't make any sense to me. But all of these hurt one thing for you, your biggest bonus. Would that make sense now? Your ability to get the biggest bonus in the job that you do is impacted by this. And if you're a business owner, your ability to be in business long term is impacted by all of these things. So, go back and say, what Oracle Security does is by securing the enterprise, allows you to give secure patient access. Why? It's fundamental to the new healthcare law. Right? It allows you to demonstrate that you have secured records. It allows you to give and decision enablement, clinician the right kind of access with the right kind of information at the right time, right? And of course, collaboration. You can actually get value out of people in screens in a secure manner. That's what Oracle Security Solutions is designed to aim at. And we do it through all of these cool things, all of which your IT guys will be extremely excited about, okay? And an example of that was Kaiser Permanente. They were able to literally get compliant to the applicable compliant laws, and they're able to get about 50% reduction in your cost of compliance. Now, for a company like Kaiser Permanente, that's millions of dollars. But for a small, medium business or a small operator, that means the business actually is open for the next year. That's what it translates to, right? University of Louisville, the same way, they were more about patient access, collaboration, the experience of, the patient experience, that he felt personalized. He was not a number. He was not a person who was just being prodded and poked. So they basically came and says, by a secure environment, I could show that I could enable patient privacy and compliance. I could improve measurable outcomes as they defined it, secure the collaborate in a very secure manner, and fundamentally be able to create social networks for patients so they actually have an ongoing mechanism to interact And that's not a doctor. And you'd all be surprised why security is so fundamental to this. Actually, it is securing their enterprise and allow them to do this thing in a confident manner. Cloud. How many of you heard cloud? No? Cloud, 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 cloud. It's all in the cloud, man, right? But that's, in fact, funnily enough, 30% of the organizations will use cloud in the next few years. But the biggest challenge in a highly regulated industry today is security. Other companies like supply chain guys, they will go into cloud immediately. What that meant is they can create predictable cost models to delivering services. Their bottom line is fixed. Your bottom line in healthcare business is not fixed because you're afraid that if you give the information and put it in a place where you can't look and feel and see and touch it, somebody will steal it, and that's going to be a huge problem for you. So if you are able to leverage it in a secure manner, that industry-wide is about $11 billion cost savings. That's a huge amount. It also means that your bottom line is fixed as a company, right? Now, mobility is a reality of life. Mobile healthcare is absolutely something that you cannot get away from, right? 86% of physicians today don't have the big fat book that even a TV serial came out of. They look up pharmaceutical data online. 86% of the physicians look at it, right? And if you look at people, I, as a consumer, like the health. How many of you went to iOS 8 in Apple, the recent release? They actually have a new health app. You can't delete the app. Company like Apple recognizes that you need to have something in the ecosystem that way. So that's because why? And they're not going to do it because they like to do it. They'll do it because people want to do it, right? And 9,000 health apps, guys. And not many of them are free. 9,000 health applications. All of this is providing and consuming data for you guys. We want it, and Americans are one of the most savvy consumers in the world. Okay, we like choice, we like variety, we like to do things really fast. And that is an opportunity, and that's a reality of running a business. This is a cool thing. You could text with the prescription barcode and actually have yourself fulfilled. No more going and dropping, no more calling. It's as simple as using a mobile device. This is the next-gen business. Business you have to be if you are in healthcare business. But that's also where the biggest risk is. So what Oracle essentially does is we allow you to do three things. One is container, right? If you're a healthcare provider, we will ensure that the private information is kept in a secure place. If your cell phone is lost, we can just delete only that. If you're an employee, we can only delete only that which the company owns. That's been the biggest problem in BYOD, right? We allow you to secure your applications, all the good stuff in privacy. You can have policy enablement and all of those things which Steve will talk a little bit more about, right? And ultimately ensure that your customer experience is exceptional without losing security, right? And this is Singapore, the holding company for the Ministry of Health in Singapore. That's essentially what they have done. Through this securing it, they've been able to provide access to information of 5.3 million patients. Now, Singapore is a city-state, so you can imagine 5.3 is a significant portion of their population, right? And providing single sign-on for users. And if you know single sign-on, it's like your iPhone fingerprint thing. So you can do that. Your identity is verified. You can go all over the place and do the things that you're supposed to do and can do, right? And then patient confidentiality and regulatory compliance were met by the three methodologies that I had in the previous slide, right? And this is Oracle's story. I'm not going to go into each of these things, but there are three aspects to it. One is preventive, stop bad things from happening in the first place. Now, if it does happen, know it as it is happening so that you can take some action. And then administrative, to ensure that you can put your policies and your processes in place. Okay. Finally, and this actually is the last but one slide, right? All of this is how we provide in a single integrated stack. What does it mean? it's easy to implement. That's what it translates to, right? You can get to identity governance. I know who you are, absolutely, certainly, right? It's about mobile security. I don't care how you come to my environment and access information, I will secure it. And directory services, things like login, access to applications. Doctors have a different kind of access to information than a nurse, than somebody who is just billing, right? Manage their own chart. And then do all of that in a partner ecosystem through one integrated stack. And that's Oracle philosophy. Integrate everything natively so you use what you want at the time you want to use it most effectively. So, the new perimeter, right? People, data, devices. And that's what we talk about at the end of the day. All the things that we have spoken to you today is about addressing these three areas. That's the new. It's not payer, provider. It's people, the devices, and data. And if you were in the morning sessions there, they would have spoken about all of these three things constantly. I believe, yeah. According to CSO Online, I have some statistics I'm reading off of here. 67% of security spending is aimed at securing the environment. So 67% of your cost that a security organization does is only about ensuring that the network is not breached, right? 14% of IT organization budget, sunken cost, is purely on security. Now think of a company, $1 billion company. A company typically spends between $60 to $80 million on IT. That's about 6 to 8% of their annual budget on IT. 14% of it is purely is aimed at securing the enterprise. That's 14% that you cannot use for things that can help you make more money. Right? So, what we are trying to do is help you reduce the cost of doing this, but get more effective than you have been doing those things.